I'm Dr. Shoiba Saldana. I'm an obstetrician gynecologist and I happen to be a lactation consultant also. Breastfeeding is essential for the well-being of the baby, and unfortunately it has become so fraught with difficulties and worries and anxieties that it very often seems to be failing. Breastfeeding is the next step after pregnancy and delivery, and so if it doesn't work well or there are too many worries and anxieties, the mother can get completely traumatized and upset and worried. Inherently, most of the actions that human beings do are learnt behavior. So whether it's about eating with your hand or eating with a knife and fork, or whether it's washing your bottom with water or with tissue paper, they are all learnt. You don't know it instinctively. I'm glad you mentioned the urban woman as in contrast to either the rural or else a girl who has grown up in the slums, because an urban woman, because of the middle class culture which has developed, which makes breastfeeding something to be kept private, not something which is just something which is done within the family environment. A girl growing up in an urban situation hasn't seen anyone breastfeed, whereas a girl in a village or in slums has seen her mother breastfeeding her siblings, has seen her sisters and sister-in-law feeding their children, and so inherently she has already learned, though she hasn't realized it, how to hold the baby, how to burp a baby, how to comfort a baby. So the issue is that they need a lactation consultant because of a lack of learnt knowledge. So a lactation consultant in a way helps women by explaining positions, explaining how the process of milk coming up, because a lot of women don't even know that on the first 24 hours you don't get any milk. Second day there's about 20-30 ml. The third day the milk starts coming in and you get breast engorgement, and they don't know that. So they're really worried, and all babies lose 10% of their birth weight in the first 3 to 4 days. But this causes panic because they say, oh my God, the baby's weight came down. That's never meant to happen. And so they start putting the baby onto formula and disregarding breastfeeding. Well, one of the things is after delivery, when a woman's stitches are paining and her breasts are engorged and she's had no sleep because of a crying baby, is not the time to start off explaining lactation to her. It should have happened in the antenatal period. So she should have sat with her family, and breastfeeding is a family job. So the partner, her mother, mother-in-law, any of the people who will be involved in looking after the mother must be involved in learning about what are the issues which they would face while breastfeeding. And the other thing is a myth. Sometimes it's very important to ask them, what have you heard? Because they'll say, oh, my friend had no milk. And somebody else will say, the baby never sucked, or the baby cried all night, and things like that, which cause a lot of stress. So they already have these worries, which then, become self-fulfilling prophecies. I would say stress and anxiety seems to be the riding emotion for pregnancy and after, for the simple reason that most of the women haven't even planned the baby. They are persuaded to become pregnant by families, though they're not willing for it, not they're ready for it, and they have a baby whom they haven't actually wanted. On top of that, if the gender is different, they wanted a girl, they got a boy, they wanted a boy, they got a girl, or the color is different, it really upsets them. I had this lady who had a baby, and it was a baby girl. She was happy, husband and family were very happy. Started off with the breastfeeding immediately after delivery. The second day I came for rounds and I found her sitting and crying and the baby looking very upset. And then she said the baby's cried all night and hasn't fed at all. So I tried to find out whether she had stitches, pain in the stitches, she hadn't eaten well. And I found something not okay in the room. So when I questioned a little further, what I found was the mother told me that the aunt had come inside and said, oh, what a dark baby. What a pity she's a girl. And that had set it off. So the woman who was really happy, started off breastfeeding well, just dropped to zero because of an extremely insensitive comment by a relative. The main hormone which is secreted during breastfeeding is called oxytocin. This is also known as the cuddle hormone, used very often in Valentine's Day celebrations. However, this really helps in bringing attachment between the mother and the baby. And during breastfeeding, the mother relaxes, and it causes a lot of comfort for the baby, because the baby has now been taken away from its natural environment where it was sitting for 9 months. And now when it is settled on the mother's breast, it's actually hearing the mother's heartbeat, which was the running sound in the baby's life for the last 9 months. So breastfeeding inherently calms a mother and a child. So the bonding definitely increases from there. But also beyond that is the ease of breastfeeding. A lot of women, when they wanted the baby, when they're happy about the baby, can cope with all the initial hiccups. And unfortunately, with us human beings, babies need to be taught how to breastfeed. It doesn't happen with puppies and kittens, but only with us. So how the baby is held, picked up, all that makes a difference. Industrialization is one of the main reasons why breastfeeding has been harmed, because when they needed a greater workforce, the entire concept of formula feeding and bottle feeding came in, and it actually harms the growth of a child who would be actually perfectly looked after if it was breastfed for a year. And all the concepts of maternity leave not being given for more than 84 days, which is a standard in many governments, and private firms which give even less, is terribly harmful for the child. In spite of that, mothers who are determined can breastfeed. Even if the woman breastfeeds through the night, she gives the baby something like 500, 600 ml of milk every night. And during the daytime, she can express milk. She can give the baby other weaned foods and totally avoid the bottle and formula feeds. So the first question one would like to ask, if a woman is suffering from psychiatric illness, is she capable emotionally and physically to have a pregnancy and take care of a child? That is a bigger question, because unfortunately, especially in our Indian cultural system, it's presumed that if anyone has a mental disease, you just get them married off and have a baby and everything's going to be fine, which is doubly harmful both for the mother and the baby. So in psychiatric diseases which are well controlled with the complete compliance of the mother and her partner, only then should a pregnancy be started. They need a lot more support, a lot of care, especially about understanding what medicines to take. And even postnatally, if a woman has a psychiatric disease, she can still breastfeed without any problems and be on medication. When a woman breastfeeds with confidence, she enjoys both the process of breastfeeding, she enjoys her baby, and she enjoys her post-delivery period. It enriches her enormously, both in giving her an emotional experience which she would have never experienced otherwise, as well as gives the baby a fantastic start in life. In fact, a lot of times we consider that breastfeeding is the first immunization for a baby. The emotional stability a child gets, the ability to withstand infections, the bonding and strength that babies have, and which we now consider as the attachment to the primary caregiver, is hugely enhanced by breastfeeding. But this will not be possible unless we realize that the mother breastfeeding the baby is a small part of the family dynamics. It means the mothers-in-law, the grandmothers need to support the mother. It is very important for the husband to be part of this entire process, because for a woman, her husband's emotional support towards her and the baby makes a huge difference.